I'm Deanne Lacaille, a rheumatologist at the University of British Columbia, and I'm going to demonstrate how to do a joint count. This is when we count the number of tender and swollen joints for assessing disease activity in people with inflammatory arthritis, such as rheumatoid arthritis. This is an essential part of evaluating response to treatment to determine if people have reached their target in the treat-to-target approach. With practice, this can be done quickly. It'll take a few minutes during a patient visit. I start with the patient sitting. To test stress tenderness in the shoulder, I immobilize the scapula, bring the shoulder 90 degrees of abduction, then external and internal rotation. To test stress tenderness in the elbow, I flex and extend the elbow. To feel for an effusion, I feel between the olecranon process and the lateral epicondyle in the groove for some thickening, and then bring the elbow in extension to feel for swelling in that area. For stress tenderness in the wrist, I test it in extension and flexion. For swelling, I feel at the distal end of the radius before the carpal bones with my two thumbs and place my two fingers directly under, and I press alternating between the two thumbs to ballot for an effusion. For the MCPs, I do stress tenderness in extension. For swelling, I like to hold the joints like this to support them well. I feel for the joint line right here, which is a bit more distal than you may expect. And with the two thumbs on each side, I press alternating on one thumb and on the other thumb to ballot for an effusion. For the PIPs, I test for tenderness with pressure rather than stress tenderness. And then to evaluate an effusion, I use what's called the grape technique with two fingers on either side and two fingers on the top and bottom of the PIP. And then I alternate pressing with the fingers like this to ballot an effusion. And I do this on each of the fingers. Then I ask the patient to make a fist. Can you close your hand? And I expect the patient to be able to completely hide their nails, and a tuck, open and close just this part. And I expect the fingers to touch the palm. And that's it for the upper extremities. Can you lie down now? To test stress tenderness in the hip, I bring the hip in full flexion, and then I bring it to 90 degrees and test it in external rotation and in internal rotation. And it's important to make sure that the hip stays in neutral position when we do that. And then to test stress tenderness in the knee, I bring it in flexion and in full extension. To look for an effusion in the knee, I do the bulge sign, where I milk the fluid medially and swipe laterally and look for a bulge on the medial aspect of the knee. And the patellar tap, where I milk the fluid in the suprapatellar pouch and then place my fingers on the patella and tap briskly to feel the patella hitting the femoral condyle. The joints of the ankle and the feet are not included in the joint counts of the C-die and the S-die to assess disease activity. And that's because in general we get the same information from examining the other joints. However, there might be situations where it's useful to examine the feet if patients have complaints isolated to the feet. To test stress tenderness in the ankle, we do flexion and extension. And to evaluate for swelling, I put fingers on each side of the extensor tendon and press on one finger and the other, ballotting for an effusion. For the subtalar joint, I keep the ankle in the neutral position and I hold the heel and do stress tenderness with inversion and eversion. For the MTPs, a quick screen test is to just do the squeeze test and ask the patient if it hurts. Or we can stress each of the MTPs in flexion. Now I'm going to demonstrate the joint count from beginning to end without explanation so that you can see how long it takes. I'm going to be moving your joints and I want you to tell me if it hurts. And tell me if it hurts. Now can you make a fist? Now open and close like this, touching your fingers with your palm. Thank you. Can you lie down now? And tell me if it hurts. Does that hurt? And we're done for the joint count. If we want to do the feet, and we're done.